Hello, Assalamu alaikum. So today we're going to do clindamycin, which if you did the macrolide jelly video or if you know anything about erythromycin, which is the prototype macrolide, this should be a piece of cake for you, okay? The word be wahi wala macrolides, so let's just get started. So its mechanism of action is the same as macrolides. It's bacteriostatic, but it's bactericidal in high doses. It is also an inhibitor of 50S ribosomal unit, and it inhibits chain elongation and translocation, जिसकी वजह से प्रोटीन सिंथेसिस inhibit करता है. ठीक है, इसकी pharmacokinetics भी are the same as erythromycin, where it is acid labile, but with erythromycin we can give it orally or IV, but clindamycin we mostly prefer to give it IV. ठीक है, यहाँ पे थोड़ा सा डिफरेंस है. जहाँ पे differences होगा I'll point it out, but more or less you should just remember erythromycin. Same for its pharmaco kinetics. It has a large volume of distribution, but it does not cross the blood-brain barrier, just like macrolide. Excretion is also the same as erythromycin, uh, which is like hepatic excretion. Iski side effects are also the same as erythromycin, which is that it causes diarrhea. However, this does not. This has an extra and very important दूसरा एक side effect, which is it causes pseudomembranous colitis, जो कि Clostridium difficile की वजह से होता है. This can occur like this can be caused by a lot of other oral antibiotics such as penicillin, cephalosporins, all of those things. But clindamycin is a very like strong indication for pseudomembranous colitis. ठीक है? So this mostly causes pseudomembranous colitis. Now coming to its spectrum, तो मैंने जो blue चीज़ें हैं ना, ये erythromycin का spectrum है. ठीक है, तो I think just like keeping that in mind, I can tell you कि कौन सी चीज़ें erythromycin वाली है, कौन सी नहीं applications. For the most part, this does act on gram-positive bacteria and it acts on anaerobes. ठीक है, तो it's not very broad spectrum. Coming to gram-positive organisms, it works on जैसे erythromycin की तरह, it does work for cellulitis, it does work for otitis and sinusitis caused by streptococcal organisms such as बिल्कुल जो prototypical है strep pyogenes की वजह से जो होता है. For Clostridia, it does not work on tetanus. However, Clostridium perfringens की gas gangrene को ये prevent कर सकता है. ठीक है, it is not used for diphtheria, but it is used for MRSA. This is different from erythromycin, which is not used for MRSA. Erythromycin was also used to treat Neisseria conjunctivitis neonatal and chlamydial neonatal conjunctivitis. However, this is not used for that, so I will not be circling that. This is not used for gram-negatives. Okay? For anaerobes, which is a very specific application for clindamycin, it is used for bacterioids जो कि oral cavity में reside करते हैं. ठीक है, these are gram-negative organisms that reside that are हमारी oral flora का part है. So bacterioides की वजह से जो oral infections cause होते हैं, or if it is as aspirated, then this can also cause peritonitis, aspiration pneumonias and lung abscesses. तो इन सब applications के लिए we use clindamycin. Again, like propionibacterium acnes, something like that, P. acnes, उसके लिए भी ये इस्तेमाल होता है for treating. It's given topically for acne vulgaris, and Gardnerella vaginalis के लिए भी ये इस्तेमाल होता है to treat vaginosis. इसके अलावा if there peritonitis से अगर हम लोग इसको link करें, तो जब भी there are some pelvic inflammatory disease होता है या anything that has to do with the female genital tract, तो उसके अंदर there's if it's caused by gonorrhea या Neisseria gonorrhea chlamydia, तो उसके लिए we have other regimens. However, if the PID is caused by sepsis, septicemia, या फिर यहाँ पे बहुत ज़्यादा organisms invade हो गए हैं, तो part of the regime of treating PID that is polymicrobial in nature. So for that we do give clindamycin because it's very strongly indicated for anaerobes. So this is given along with gentamicin. So gentamicin and clindamycin are given for a lot of like PIDs and like endometrial infections, stuff like that. ठीक है? तो या दिस इज़ सॉर्ट ऑफ नॉट दैट इम्पॉर्टेंट. मोस्टली जो इम्पॉर्टेंट है वो ये इसका एक्ने वगैरह, बैक्टीरियोइडिस इन्फेक्शंस, मर्सा, स्ट्रेप्स, परफिंजीज, क्लॉस्ट्रिडियम परफिंजीज के लिए है. एंड यू शुड रिमेंबर pseudomembranous colitis. That's about it for clindamycin.